Newborn screening tests for many serious but treatable disorders. Babies with these disorders may appear well at birth but can become sick very quickly if untreated. Screening is highly recommended for all babies and uses a few drops of blood that are collected onto special cards when the baby is 2 or 3 days old. In this video, you will see how the cards are tested. The cards are sent to the Newborn Screening Laboratory at Victorian Clinical Genetic Services, located at the Royal Children's Hospital and funded by the Victorian Government. This is the only laboratory in Victoria that does this testing. Similar laboratories operate in the other capital cities. It's important that the cards are sent to the lab as quickly as possible. In the lab, the cards are sorted, assessed for quality, and the details are entered onto the computer system. If samples aren't of high quality, maternity service providers are asked to send a new sample as quickly as possible. Small punches are taken from the blood spot and put into plastic plates with 96 wells. The Victorian Newborn Screening Program performs several tests on these tiny punches. One tests for thyroid stimulating hormone, or TSH. High levels of this hormone can indicate that the baby's thyroid gland has not developed properly or is not functioning normally. Any blood spots with high TSH results are repeated to make sure the result is consistent. Another test for a protein called immunoreactive trypsinogen, or IRT, checks for cystic fibrosis. If the IRT is increased, a second genetic test is required. The genetic testing is a slower process. It can take several weeks before the final newborn screening results are available for some babies. A technique called mass spectrometry is also used to measure a range of metabolites in the blood spots. For example, phenylalanine measurement detects babies with phenylketonuria. The mass spectrometer is very sensitive and results can sometimes be affected by any traces of contamination. That is why it is important to keep the cards in a clean place before and after the blood collection. The newborn screening lab uses a 2-colour flag system. A very high level will trigger a red flag, which carries a high risk that the child has a disorder and usually results in a clinical referral to a specialist clinician to organise prompt confirmatory testing and treatment. A slightly increased level will trigger a yellow flag. In this case, while the baby may be affected by a condition, the results can also be caused by sample contamination, prematurity, or jaundice. This usually results in a request for a repeat collection. It's important to reassure parents that a request for a repeat sample is not an immediate concern, but it is still important to get these samples to the lab quickly. After all the testing has been completed, the cards are stored for a minimum of 2 years, just in case anything needs to be checked later. The majority of cards are never used again. A small number may be used for research or to develop new tests, but only if parents have provided consent. Parents can request to obtain the cards after 2 years. Scientists at the laboratory screen hundreds of babies every day. From those of us in the lab, a big thank you to all of those who helped to get the samples here and who care for the babies we're here to help. More information about newborn screening can be found at vcgs.org.au or betterhealth.vic.gov.au.